at the Human Garage over a decade of working, we started to see that things didn't correspond to the typical muscle skeletal view of the body. So we looked for other answers. We looked at a simple answer that you have an arm here and you've got 3 different muscles coming in here and 3 here, bicep and tricep. How it actually moves, we say it's mechanical, but that would mean a wire goes from here to here and it's like a crank and it cranks up. But what really happens is blood rushes into there, rushes into a muscle sheath and starts to swirl. So we actually consider the body hydraulic. So for this purposes, I just want you to think of hydraulic systems rather than mechanical systems. When all the blood comes in here, it pumps this up, causing this to lift. That's the actual mechanics of the body from the way we see it, okay? The body is divided in 3 zones. We've got from the neck up to the top of the head, and these are pressure zones. And then from the neck to the pelvic floor, and then from the pelvic floor through the legs. And for the purposes, I want you to consider the legs as one zone, not 2 separate zones. And also with the arms, they're part of zone 2. And anything that changes up here has to have some sort of change here and some sort of change here. So often when we're looking to fix a knee problem, we might find it actually in the hip or the shoulder. And we know this from doing therapy for many years, but in the relationship of working on the knee, I might actually go up to the elbow and work here and the shoulder because the knee pain is chronic. And one of the things that I want you to understand is this is super simple. Any single person can do this. You don't have to be a therapist. You don't have to be a doctor. This is simply moving the body. So the basic movement of the body is breath. And what we want is breath to be moving all through the body. But if we have this all stuck up here, like this, and she's breathing, this is going to force the breathing out over here, and that breath is not going to get into this area. So these are some of the things that we're going to open up and deal with today. The first reason why we're creating these videos is that after spending a decade working on some of the top athletes in the world and creating new programs working with fascia, at the end of it we found out that it was so simple that anybody could do it themselves. And it's just simply by looking at the body in a different way. And the body, the way we see it, is muscle, skeletal, bones, nerves, everything on top, but we see it from the bag down. So we say you have skin in here, and there's 14.7 pounds of pressure per square inch pushing into that skin or all the way around the body. So that's, on average person here, is going to be roughly about 2,000 pounds. That means that inside the body pushing out, we have to have another 14.7 pounds pushing out. That means that we're biotensegris. This is like a balloon. And imagine the skin, which is very much like a balloon. It's elastic and it stretches really far. And inside of it, we have pressure. Now, we know we have pressure in our lungs, but we don't always think about pressure in our legs. So we're going to take a look at some of those things today. When we change the pressure in one zone, like for example in the head, if we move something here, the body then has more pressure here, and this is 1/3. Every part of the body is counterbalancing for movement. So that means if we change something here, something over here has to change, and then something over here has to change in order for the body to balance. Each segment of the body has parts that are very much the same. For example, this is a nose, and this is kind of, for the center of the body, the xiphoid is kind of a nose. And it also looks like on the back, the tailbone is kind of a nose. And these 3 areas are referencing to each other where to move. Now, if I was going to torque there, why wouldn't I torque there? Now, I'm going to torque this way. I'm going to torque clockwise. I'm going to do it right here so I get the nose and tension. And all I'm doing is pinching my fingers like this, and I'm going to turn it, and again, I'm turning it clockwise. There it goes. I'm pushing down and twisting and turning the skin. And you can use your other hand to leverage to get a bit more. There it goes. Because again, the body here, we're just moving the fascial layers and everything else that comes in between. So torquing right there. And as I'm holding it, what happens is the As I turn and get more torque, then the fascia releases and it feels like it relaxes, and then you can turn it a bit more. You don't want to overturn this. And what I mean by overturn this, you don't want to cause pain. You just want to cause enough pressure that relaxes. You feel that relaxation?
I can feel it through my palate.
Yeah. This is similar to some of the fascial maneuvers that we do, but this is the origin of where they came from. Okay, good. What do you notice?
The whole, I can actually feel the torque through my head, and I can feel it releasing and like a wave.
Right. Okay, now we got one more area, because we said we got 3 areas. We have to go below the belly button into the pubic region. Okay, is it okay if I go right to your pubic bone?
Yes.
Okay. You want to ask anytime you're touching somebody first, but so right above the bladder. So we're going to turn this. We're going to turn this the same way that we turn the stomach, which is opposite the head, the belly button. So I'm putting it right on top of the bladder. Do the same torque here. What this is going to do is going to apply that same pressure sensitivity right into the hips. Breathe. Now, what she's going to feel is a tightening around the hips, right around the glutes. You feel that? And a tightening around the tailbone. And as we get older, we have pressure. Meridians go right from the bladder there, right around the back. And that's where we get little lines in our hips. It makes it look like we have love handles or something like this. This will help you get rid of your love handles. Right there. Breathe. Say, I no longer need this fear in my body.
I no longer need this fear in my body.
There it goes. The whole hip started to release. And we're just holding it there and keep tightening it until the body's ready. And you'll generally know. You can turn a little bit more. You always look at the person. You doing okay? Okay. So basically, if you're going to do something in one area of the body, you want to repeat that action somehow or some way to find it on all areas of the body. How's that feel?
Very relaxed, and then I can feel it pulling through, and now it has released and it's falling back down.
So normally this would be like a yoga class, or it would be like a practitioner stretch, or going to a practitioner or a body worker. And just simply by turning these 3 zones, we loosen everything up. You can walk easier, clearer head, your sight and your hearing is better, your hips are going to be a bit better, your emotions will be regulated because the pressure on the bladder controls everything. If the bladder is tight, every other organ in the body becomes distressed because bladder is fear. Okay, let's go for a walk. Now you're going to feel like you walk really good. Think about the belly button. This is one of the most powerful moves that you can do fascially or for the whole body. When we're born, the umbilical cord comes here and it starts out here and then goes all the way to the spine and up the spine. So this attachment, even though we cut it here, the fascial attachment goes right through the belly button to the spine the same way it was connected through the birthing process. So what we want to do here is every nerve, every meridian, and every part of the body centralizes here. So this is one of the most powerful things you can do. You don't have to be a practitioner to do this. This will release the internal pressure around the organs, bloating, gas, hip pressure. It will also release tension in the stomach, and the entire body is going to benefit from this. So what we want to do is, the body in fascia likes to work in spirals. Now we think of the body being linear and having long muscles, but that's not how we're created, and that's actually not how it moves. So if we take here on the belly button, what we're going to do is we're going to do a belly button untorque. And why we call it untorque is because it got torqued up. When we sit on our chair, what we're doing is putting pressure, and the body starts to move like this. And that attachment that went from the belly button to the spine starts to move like that too. And over time, it just gets twisted. So I'm going to put my hand in here. I'm going to use my hand. I'm going to use it by turning it. Now I'm going to turn this counterclockwise. And you see I'm going to go from the right hip to the left hip all the way around. And I'm going to put one hand in. I'm going to push in the belly button. And I push in pretty hard. I'm pushing in with about 9 pounds or 10 pounds of pressure. And then I'm going to turn like this. So you can see the shirt turning and twisting. Now when I get to a maximum point here, what I'm going to do is take my other hand, take it over top, and I'm just going to provide more leverage. So this other hand comes in here as a leverage point, and then I can turn both hands easier. Now it's going to be very uncomfortable for her at first. It's going to feel like there's a bowel movement happening, which is completely normal. You feel that there? And you can see her starting to breathe. And then as I do this, now I just keep turning, and I'm constantly turning the tension because it's unraveling inside. And what you're looking for is a feel. What happens is as you torque, you start to feel pressure build up, and it's actually tension in the hand and the wrist. But then as she breathes, that tension starts to go away. So as the tension goes away, we want to increase the tension just a little bit more. So we want to keep it at a constant max, basically. There you go. You doing okay there? Okay. So what we're going to do is this is what I call programming state. Through anything through the belly button, anything counter-rotated is what we call programming. So our nervous system gets programmed every day by things that we say. If we tell ourselves we're bad, we're good. We tell ourselves we hate people. So we can just mechanically erase these. And we can start off with some basic ones. And I want you to take a look at the body and how it reacts. And maybe even watch your face a little bit there. So you just repeat after me, Carissa. Say, I love myself.
I love myself.
Well, that's an easy one. A little bit of response in the body. I'll tighten up a bit. Just say, I love my mother.
I love my mother.
That one's a little bit tough there, but the body's really relaxing on that one. You can see her face starting to relax. Just say, I love my father.
I love my father.
Okay, we're getting a whole level of reaction. Basically, the body's responding to everything we do. When we talk, our body's job is to figure out what we're saying and how to respond to it. So it's responding again. Just say, I forgive myself.
I forgive myself.
Okay. And we just keep tightening it up. And see, I got a little bit more room here. For this case, I'm going to move around because I'm actually running out of room. Just say, I no longer need to hold this pain in my body.
I no longer need to hold this pain in my body.
Whoa, the whole body just calmed down right there. That's super neat. Okay, we can ask other questions. Now I'm actually in the belly button, and I can feel the belly button right now on my middle finger. It kind of feels like it's torquing around, so I can feel the attachment. Do you feel that as well?
Yeah.
So she feels it as well. It's a bizarre feeling, but it certainly is good. Okay, now, oh, there it goes. Now I feel it starting to move into the hip. And I can actually track it down if I want. I can go right through, it'll pass right through the organs. It'll actually separate them. And I just keep turning. Okay, and then there'll be a point where the body just says, I'm learning to not be so hard on myself.
I'm learning to not be so hard on myself.
There it goes. You can say whatever you think is appropriate. And as I unwind, now there's going to be a little bit of redness around the belly button, and you'll actually see the torque marks right here. These are the unwinding. Now imagine these fascial layers are going all the way over here, all the way down here, all the way here, all the way here, in a torque. So these spread out through the whole body in each and every way. And it's a perfect example of what you're seeing right here. How do you feel, Carissa?
I feel amazing.
It's a little weird, isn't it?
It feels good. I could feel different layers of the body waving to relax. And as we went through affirmations, I could feel how they triggered emotions. And how the body resisted or let go.
Yeah, isn't that cool? Okay, so the most powerful release position for the whole body next to the belly button on torque is the fetal position. Why is the fetal position so powerful? It's because we spend 9 months of our life in there, and the body has memory. We call it sometimes muscle memory, but let's call it fascial memory. And when the body's growing, the fetal position is where it has all of its information about how it grows. So between 0 and 9 months, we grow more than, and we change more than any other time in our life. So when we put the body back in that position, it naturally relaxes. You'll also notice that when people are really scared, they'll go into a fetal position and crouch down. And that's very normal too, because the body's going into safety, reprogramming, or highly adaptive to the situation. So we're gonna have her lay on her side like this. We're just gonna take one leg, put it over like this, and what I'm gonna do is I'm gonna take my right hand, I'm gonna use my whole arm. And you can do this on a table, you can do it on the floor, you can do it on a bed, anywhere. So it doesn't have to be on a table, today we are. See how I got my whole arm under here? And then I'm gonna grab the hip. Now what I'm gonna do is I'm gonna push her up like this, and get you to fold your hands over. And then I'm gonna take her head, and I'm gonna roll her into a little ball. And once I get there, I'm going to get on top, and I got my hand right around underneath the tailbone. And I've got her head turning a little bit to the right. And from here, what I'm going to do is I hold the body and breathe with her. I want to go to a position, hold it there, and once I'm there, there you go. The body adapts. I put it into another position. And any affirmation you want to say in here is good. Anything you want to add to your life or subtract.
I am done with fear.
I'm done with fear, good. Now if you have more people, you can have other people hold. 2 to 3 people on the body at all times is the best. There we go. And the body gets to a point where it just starts to relax right now. Then we'll unwind her. Now, when you do this, she's not going to feel like moving for a while. And she's probably going to feel like, well, how do you feel right now? Buzzed. She's going to want to be back in there because the feeling is so good. It releases dopamine, serotonin, oxytocin. Your body feels high and happy. Is that how you feel right now?
Yes.
And do you want to get up or do you want to just stay here? They're going to want to stay here laying down here for a bit because the body is really going through a rebalancing and re-understanding of everything that's going on. You give them a minute. And again, you could do this on the floor, on a bed. You can do this with your kids. You do it with your grandmom. You can do it with anybody that you want.
Dogs.
You can do this with your dogs. Yes, absolutely. Okay, feel good?
Feel good.
Okay, let's go for a walk. Okay, now we're working on Jason. This guy was a soccer player, so there's a lot of tension on the internal hips, right around the bladder area. So what I'm doing is I'm over the pubic bone, I'm doing the belly button untorque, same thing, and I'm doing it right underneath the bladder. And so what Jason was feeling was bladder, prostate area. So this is really great for prostate, also great for enlarged bladder, also helps with small intestines, also the large intestines. Oh. That's going to be a big change. Well, first of all, most of the time you might have a leg that's presenting shorter, but anatomical shortness you can only tell by measuring an x-ray. So if anybody tells you you have a short leg without doing an x-ray and actually measuring it, it doesn't mean it's short. And in my career, with over 15,000 bodies I've touched, I've only seen 4, maybe 5. So what we're going to do with a short leg is that basically what we're looking here, and if the leg is short, we're going to take, and this is the malleolus bone right here. So it's the bone on the ankle bone. if I put my thumbs together, you're gonna see that this thumb here looks shorter, right? But most likely, she's not shorter. Most likely, this hip is gonna be raised. And you can feel right over here, it's tighter, the fascia over here, it's nice and loose. So really the issue is coming in the hip. So there's two things I'm gonna do. It's on this side. I'm just gonna take the fascia, I'm gonna wrap around here like this. And take my other hand, put it on the hip. I'm just gonna pull this way. And you see, all I'm doing is giving a good stretch. I mean, these are stretches that you can't get by yourself. And I'm just pulling up and away. And they might feel a little bit of a burning sensation. Do you feel that? No, it's pretty gentle usually. There it goes. Okay, now the hip relaxed. So this is the first thing we want to check. Let's come back here and see how this does. Well. What do we have? We have equal legs right now. Another thing you can do to support this, because all the fascia in here is tight, is take your left hand, say grab underneath there and get it underneath the ankle, right hand on top. And you see how I'm grabbing on top because I want to pull. And what I'm going to do is I'm going to sit back and pull. Okay, and then I'm going to rotate the leg inward slightly. And I'm just pulling, I'm using my weight, I'm not using my arms, because if I use my arms, it's going to be a lot of work. But if I just lean back, it's easy. Now what I want you to do, Chris, is I want you to turn your foot away from me. So she's going to engage by turning her foot away, and it creates more fascial rotation. And you can actually start to feel the fascia moving. And one of the things I can do is come out a little bit like this. Pull it, come back in. This may look like a leg pull, but it's not. Now I'm going to go the other way, right hand under. This one I'm going to go and I'm going to pull right down here through the medial arch, and this is also your liver meridian. So same thing, pulling. And I'm literally trying to pull the skin down because that's how the fascia works. It's attached there, everything's attached. We pull it and we hold it, and there we go. Leg softens up. Loosey-goosey. Okay, here we go. See, if I was part of the problem of being in business, if I did my work, every client would be 30 to 45 minutes. And 90% of them would never come back. Anybody has knee or lower back issues, here's a really simple one, okay? Now you can do this, we're doing it on a table today, but you can do it on the floor anywhere. So you take the knee, take both hands, and what you're gonna do is circle the knee like this, and you're gonna rotate this way. So you're gonna rotate counterclockwise for the right knee, but basically into the center of the body. And I'm using my weight to rotate. So I'm not turning with my hands, I'm walking my shoulder to get leverage, and I'm turning my body, that creates the pressure. Now she's gonna start feeling the knee. If you have any knee issues at all, and then I'm just gonna slowly move it over here, give it a little bit more action over here. Great, and now the knee and the quad and everything's starting to release. And we'll go a bit out here. You got that hip bone just went there. And holding it there. Give it about between 15 and 30 seconds for each spot. Now the knee is really, really soft. How about lift that leg?
Feels good.
Lift the other leg.
This is my knee.
Okay, this is a scar. This is from some surgery, right?
Motorcycle accident.
Motorcycle accident. Well, that's road surgery. So what we're going to do is all of this here is fascial and it's caught up and bound up. That's why it's white. So every scar has to be remediated because it pulls the fascial tissue, which pulls the muscle. So what I'm doing is I'm literally stretching around the scar here. And I'm twisting the fascia like this. Remediating, pulling it back. There it goes. And what's happening is I'm literally just pulling the scar apart here. And this is a number one reason for injury is scars like this, that injuries that are repetitive. There we go, right, this. Scars or adhesions. And so what this is doing is opening everything up here, and you'll see as I do it, here's where the stitch was. See that? That's exactly where the stitch was, right through here. And what we're going to do is open that up. And as we open this up, she's going to start moving again. And everything will start to open up in her leg and her knee there. Oh, there it goes. Awesome. Let's do the other one. So what we're going to do with the tight IT band right here, first of all, IT bands don't get tight. Now you may experience tightness there, but it's not the IT band. So working on this is going to make it worse. So what you want to do is take the knee, put it up here. You're going to take the fascia, and this is, you could do this on a table, you can do it on the ground, anywhere. And you're going to wrap your hands around it here. And I'm going to rotate this way, inwards to the body, like this. And I'm using, you see here, if I use my arms, it's going to create too much. So I get my arms there, move up with my body, put one arm against my body to create leverage. And what I'm doing is I'm driving and then creating tension. And I'm going to wait there for about 45 seconds. And you'll start to feel the skin around the knee move. You'll feel the quad open. And her leg naturally wants to go down. So I'm going to take it down here a little bit. And this is going to, oh, good crack there, opens up. And I've got a lot of rotation force. It's not going to hurt her. And I'm going to push this way. And this is where you're going to get your IT band. And this is also the gallbladder meridian, large intestine meridian. And it's going to open that up all the way through here and down into here, into the hips, right up in the back. And then we're done. How does that feel? Lift that leg.
That's amazing.
Okay, so you got tennis elbow, you got sore elbows and sore shoulders. Here's one of the simple things to do. When you're with somebody, you want to help them, you're going to take the hand, put it like this. Now, you could do this on a table, you could do this on a couch, you could do this on the floor. And again here, you're going to see the elbow here, the skin of the fascia. We're literally going to torque the skin, which torques the fascia, which then torques the muscles and then affects the bones. So I'm going to take here and I'm going to turn it, same way I did the knee, like this, and hold it. And then breathe. So she's breathing. And what's going to happen here is, oh, there you go. Starting to feel the release. The arms letting go, shoulders letting go. The wrist and hand are also going to let go. This helps with carpal tunnel. It also helps with a stuck wrist. It helps with a shoulder, or a frozen shoulder. Really great. And just hold it there and breathe. You want to hold this for about 3 to 5 minutes. Okay.
This is nice.
See how the leverage here? Because the bone there.
Yeah.
So if I want, I can go like this.
Oh, you got me.
Yeah. And I can go like this. And see how fast that works?
Woo.
Because the stress is higher on the body.
Woo.
And the body has to figure out, how do I get out of that faster? But I'm not pushing in. I'm just creating a mechanical issue. So the brain starts thinking, how do I deal with that? There it is. Oh, let go.
Oh.
Okay, let's go for a walk.
Okay.
Last night I saw all these stress marks coming up through her SCM, and what I want to do is lighten it up. So just like our ear pull that we do, grab the ear. I'm going to put one hand in by the shoulder. I'm going to pull the ear and turn the head away. Looks like I'm stretching really hard. And what this does is it's going to get all the tension right underneath the jaw, the front of the neck. There we go. And then the whole body starts to relax. Took me literally months of moving my head every time I got in the car to do this. So you're getting lucky. Okay, one of the most powerful moves to release the lower back, we got the sacrum. Everything moves around here, because as we move, everything in the hips has to move like this. So this area is constantly getting action, and it's twisting and winding. So I'm just going to use a really simple towel, and you can do this anybody. You don't have to be a practitioner to do this. This will work when you do it at home right now. You do it on somebody else. So I'm going to fold it in 4. I'm going to put it over top of the sacrum. Now, not the bone, but just the sacrum, the flat part. So really on her back right here, right at the small of the back, right at the end of it, that's where we're going to go. So I'm going to take, and I'm going to turn this, again, I'm going to turn it this direction, which is counterclockwise. Okay, and hold it like this. So push down, and I'm going to twist, and you can see the pants and everything twisting, so I'm getting a fair amount of twisting, and by using the cloth, I'm working with fascia only. A cloth or a towel has a lot of grip on fascia, and it stops me from working into the muscle, because if the fascia releases, the muscles are going to release. And I hold it there. Now breathe deep into here. Now what I'm going to do is move it slowly, because the slow movement then is going to help it open up even more. And you can feel that pressure in your sacrum right there?
Yes.
Okay. Now one other thing you can do to add to this one is you can take the other hand right on the CT junction, right where the neck, vertebrae, and the thoracic. And see, I'm going this way here. So I'm going to go the opposite way. I'm just going to put my hand over there, use another towel, or use your fingers, and turn it this way. And you counter toward that. This is actually representing the motion of walking. So this is going to let her whole body relax into that now. Super simple. And again, you don't have to be a practitioner or a doctor to do this. You can do this anytime on anybody, and this will help you greatly. This is one of the most powerful releases you can do for the lower back and around the SI joints, around the sacrum and the hips. There's several ways to do the hip release. This is a specific one. So lift your knees up here for me. We're going to cross one leg over top. Okay, and what I'm going to do here is I'm going to grab underneath. So when she crossed her leg over top, I'm going to put my hand through there. See that? And then I have leverage. So I'm going to move the hips up. And from here, I'm literally just going to twist and drop. And by doing this, I'm not using very much force on myself. And again, you can do this at home. You can help anybody with this. This is an assisted stretch. It's moving fascia. And I just hold it there, and I'm dropping lower, and it's twisting her hips, and then all her hips are starting to release. How's that feel there?
Oh, good.
And I can move around a bit if I want to. There it goes. Whoa, everything just loosened up there. Now, you can do this with one side, or you can do it with both. We'll do it with both today. And again, I'm sticking my hand through there, so I get a good torque. And I've got my, right here. You see, I'm using my body to hold it. So that's where the power comes in, because that's the leverage. Using my other hand, I'm just gonna wrap and twist. Come to wherever the body needs it. And you hold it. Again, it doesn't take a lot of power on your part. And all we're doing is stretching, and these are all the things that we would be adjusting with physical therapy or chiropractic, and you can just do this yourself at home. Good. Awesome. How does that feel?
Oh, that was nice.
Good release of the hips. Let's go for a walk.
Thank you.
This area of body, when we sit, doesn't get a lot of movement. There are 10 organs inside the body. 3 of them are muscles, the heart, the stomach, and the bladder. But the rest of them require this movement of the diaphragm and the movement of the body to move. So quite often, because we sit right here between the large and small intestines, called the iliosynchral valve. And what you're going to do here is there's the hip bone, there's the belly button. I'm just going to take my hands in here, and this is just like our organ release, but I'm doing it for her. This is where the organ release came from. And I'm going to take my other hand, I'm going to turn and torque, but I'm pushing upwards so she feels it right into the pelvic area. Is that right?
Yes.
And I'm just going to turn and push away. And I'm stretching the skin, but I'm not pushing in. You see, I'm not going down like this. I'm putting my hand flat and turning the top levels of skin. And holding it there, and let her breathe. And this is going to open up the iliosynchral valve if you get stuck with bloating and gas, or if you're having a lot of skin issues, if you have autoimmune disease, this is something that you want to do. There he goes. Now the whole body, wait till the whole body just calms down like it did right there. And we're going to do the other side too. Now the other side, we've got the valve of Houston, and we've got the small intestine there, but we're still going to do the same thing. These are, because it's the same action on this side where the hip is. So I'm just twisting the skin, twisting and pulling up. And then again, you just keep holding it until the body starts to release. Now you don't have to do this on a table. You can do this anywhere. You can do it on a couch, you can do it on the ground. There it goes. And then the whole body just settles. And because when the pressure rebalances here, the pressure that's pushed up to here just settled. So you saw her shoulders and everything just relaxed when this opened up. When these open up, they're going to feel a little bit of pressure in the head. You'll notice she's very flushed right here. And the reason why is when we change pressure in this area, it has to be reciprocally changed here. Now what you can do up here if you want to, is just take the skin above the ear here and push down into the jaw. So push the skin away. So stretching the skin away from the jaw, from the ear. And this is for the same area. This is for the large intestine, meridian up in the face, and do the same thing over here. So holding it right here and just stretching into the jaw right there. And you can also stretch the other way. And you can turn a little bit. Every time you change angles or turn, fascia responds. Good. This is, in my opinion, the most powerful hip release in the world. It's going to look like a lot of stretches that you guys do. But in this hip release, we're just going to have her cross this leg over top of this. And I'm going to bring the hips up right here. And you see the knees are out here. I want to pull the knees apart. So technically, I want this action. I can pull it apart here and push up, but the real power is if I can use my knees to stabilize it, see like this. So I've got her right here. Now my knees are doing the work. I don't have to do the work. Take my hands, start off by just grabbing around the knee and turning both inward. This is a good start. And you hold that for about 90 seconds or so. And then her hips are going to get softer, and you see they're coming up. Then I'm going to get her to fold across your arms. And I'm going to come up underneath the head. I've got my hands supporting behind the head, and now I'm pulling her up. There it goes. Now the whole body's engaged in this one. I can move around a little bit. And I want to keep moving angles here, but very slowly. There it goes, until you feel the whole hip drop. What did that feel like for you?
Magical.
Did you feel the hip actually drop into the mat?
Yes.
So this is the problem where, as therapists, we're always trying to keep the hips from one higher like this, and we keep adjusting them, moving the muscles that never really move because the fascia is dense supporting that. So what around the hips and around the glutes. So let's do the other side. So what this is doing is it's forcing the leg down in here and forcing the hip, which is unbalanced, it's forcing that hip to actually rebalance itself. Most powerful. Again, I'm going to go start here. I've got my knees here, really powerful. I'm going to turn here. And it doesn't matter which way you turn, just counter turn. Okay, hold it there. Whoa, there we go. Lots of release in the hip. Cross your arms. Then I'm going to pull up on the head. There we go. I can put my weight on her. So I'm not using my body force. I'm just using gravity and her weight and my weight together. I can come back up here if I want. Really good spinal decompression while you're doing it. Oh, that was a good adjustment. Never expected that. That's an old one. Okay, great. They're going to need a couple minutes to lay down. And when you get up, you're going to feel like everything's broken for a minute. It'll take 3 minutes of walking for your body to rebalance this. So she has a sore neck or sore head. Anytime you do work, if you want to get a headache gone or the pressure out of the head, you just literally take the head, take your both hands, the full scope of the head. You can go either way, but the best way to do it to start is to take the right side and turn it forward, take the back side, turn it back, and then push down and just slightly turn. So I'm torquing, I'm actually twisting like this. And then I push the head down, then I turn side to side, just very, very slowly, very lightly. And you'll feel it because the whole body will start to relax. There it goes. Her shoulder relaxed. That's how I know that's open up.